Hello and welcome back to my channel. Today we're diving into an important and potentially life-saving topic, lung cancer prevention and screening. Lung cancer remains one of the leading causes of cancer-related deaths worldwide, but the good news is that early detection and preventative measures can significantly improve outcomes. In this video, we'll discuss the risk factors for lung cancer, ways to reduce your risk, and the importance of screening for those who are at higher risk. Whether you're looking to protect yourself or a loved one, this information can make a crucial difference. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Before we talk about prevention and screening, it's important to understand what lung cancer is. Lung cancer develops when the cells of the lungs grow uncontrollably, forming tumors that can interfere with normal lung function. There are two main types of lung cancer: non-small cell lung cancer. This is the most common type, accounting for about 85% of cases. It includes subtypes such as adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Small cell lung cancer is less common but more aggressive, often spreading quickly to other parts of the body. The symptoms of lung cancer can vary, but often include persistent cough, chest pain, shortness of breath, unexplained weight loss, and coughing up blood. However, in the early stages, lung cancer may not cause noticeable symptoms, making screening crucial for early detection. Understanding what increases your risk of lung cancer is the first step towards prevention. While some risk factors are unavoidable, many are within our control. The biggest risk factor by far is smoking. Cigarette smoking is responsible for about 85 to 90% of lung cancer cases. The longer you smoke and the more cigarettes you consume daily, the higher your risk. Even if you don't smoke, exposure to secondhand smoke can also increase your risk. Radon exposure is another major risk factor. Radon is a naturally occurring radioactive gas that can seep into homes from the soil. It's the second leading cause of lung cancer in the US and is the leading cause of lung cancer in non-smokers. Testing your home for radon and installing mitigation systems if levels are high can help reduce your risk. Exposure to asbestos and other carcinogens such as arsenic, chromium, and diesel exhaust can also contribute to lung cancer. These exposures are more common in certain workplaces such as construction, mining, and manufacturing. Air pollution, particularly fine particulate matter, has also been linked to an increased risk of lung cancer. People living in areas with high levels of pollution may have a greater chance of developing the disease over time. A family history of lung cancer may also play a role. If a close relative has had lung cancer, your risk may be slightly higher, suggesting a possible genetic predisposition. Finally, previous lung disease such as chronic obstructive pulmonary disease or COPD or pulmonary fibrosis can increase the risk of developing lung cancer, particularly in combination with other risk factors. While we can't change all risk factors, there are several proactive steps we can take to reduce the likelihood of developing lung cancer. The most effective prevention strategy is not smoking or quitting smoking if you already smoke. If you smoke, quitting at any age can significantly lower your risk. Within a year of quitting, lung function begins to improve, and after 10 to 15 years, the risk of lung cancer can drop by 50% or more. There are many resources available to help with smoking cessation, including nicotine replacement therapies, prescription medications, and behavioral support programs. Avoiding secondhand smoke is also essential. If you live with a smoker, encourage them to quit or ask them to smoke outside to reduce your exposure. Testing your home for radon is another key preventative step. Radon testing kits are inexpensive and widely available, and if high levels are detected, mitigation systems can be installed to reduce exposure. For those working in industries where exposure to carcinogens is a concern, following workplace safety guidelines, using protective equipment, and minimizing exposure to harmful substances can help lower risk. A healthy lifestyle also plays a role in lung cancer prevention. Eating a diet rich in fruits and vegetables, staying physically active, and maintaining a healthy weight can help support lung health and overall well-being. Studies suggest that a diet high in antioxidants and fiber may be beneficial, though no specific foods can guarantee lung cancer prevention. Limiting exposure to air pollution by staying indoors on high pollution days, using air purifiers, and advocating for clean air policies can also be beneficial. Finally, some research suggests that regular exercise and staying physically active can help support lung function and reduce cancer risk, particularly in those who have quit smoking. For individuals at high risk, lung cancer screening is a powerful tool that can detect the disease in its earliest, most treatable stages. Screening is typically done using low-dose computed tomography, or LDCT, a special type of CT scan that makes detailed images of the lungs with minimal radiation exposure. Lung cancer screening is not recommended for everyone. Instead, guidelines focus on individuals who have the highest risk of developing lung cancer. In the US, screening is generally recommended for the following: adults aged 50 to 80 years who have history of heavy smoking, defined as 20 or more pack years, meaning 1 pack per day for 20 years or 2 packs per day for 10 years, who are current smokers or those who have quit within the past 15 years. Regular screening can detect lung cancer before symptoms appear, significantly improving the chances of successful treatment. Studies have shown that lung cancer screening can reduce lung cancer deaths by 20 to 25% among high-risk individuals. If you meet the criteria for screening, your doctor may recommend a low-dose CT scan. The procedure itself is quick, painless, and non-invasive. You'll lie on a table while the scanner takes images of your lungs. No contrast dye or injections are required. After the scan, a radiologist will examine the images for any abnormal growths or nodules. If nothing concerning is found, you'll typically repeat the screening annually as long as you remain at high risk. If a nodule is detected, further testing such as additional imaging or a biopsy may be needed to determine whether it's cancerous. It's important to remember that most lung nodules are not cancerous. In many cases, they are benign growths or scars from previous infections. However, follow-up testing is crucial to ensure that anything suspicious is monitored or treated appropriately. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, despite the benefits of lung cancer screening, many eligible individuals do not undergo screening due to various reasons. Some people are unaware that they qualify, while others may fear the possibility of a cancer diagnosis. Cost can also be a concern, but most insurance plans, including Medicare, cover lung cancer screening for those who meet the guidelines. If you're unsure about coverage, speak to your healthcare provider or insurance company to clarify your option. Some people worry about radiation exposure from the CT scan, but low-dose CT uses much lower radiation levels than a standard CT scan, and the benefits of early detection far outweigh the risks. If you're a former smoker, you might feel that quitting means you no longer need screening. However, the risk of lung cancer remains elevated for many years after quitting, which is why screening is recommended for up to 15 years post-cessation. Lung cancer remains a serious health concern, but prevention and early detection can make a huge difference. If you smoke, quitting is the best step you can take for your health. If you are at high risk, talk to your doctor about lung cancer screening. It could save your life. Thank you for watching. As always, take care of yourself and make the most of your day.